The news, the Guam Regional Medical City has just opened up its catheterization lab, giving the island greater access to treatment for heart disease. We sat down with the hospital's new interventional cardiologist, Dr. Arvind Shaker, to find out what the island can look forward to and how this can help Guam families.
So what happens after this process is that the stent would stay in the blood vessel and we would take the balloon itself out.
For decades, patients have had to seek off-island treatment for many conditions, and for conditions dealing with the heart, this is rather common, especially with the abnormal rise in heart disease on island. Dr. Arvind Shaker is an interventional cardiologist with the new Guam Regional Medical City, who just performed his first successful coronary angiogram at the hospital's new catheterization laboratory this week. Dr. Shaker is one of a few doctors of his kind on Guam. His specialty involves a mixture of diagnosing and treatment of certain heart conditions. Dr. Shaker, for the most part, performs angiograms, which involves placing a tool into a blood vessel, which then travels into the heart to be able to determine the severity of a blockage.
So what I do is basically do angiograms, and if there are blockages that are in one or two vessels more that are amenable to fixing with stents and balloons.
Dr. Shaker explains that typically patients with heart disease, such as blockage of the arteries, will first see a cardiologist, then an interventional cardiologist if needed. And in the event surgery is needed, like open heart or bypass surgery, the patient will then be referred to a cardiothoracic surgeon. Currently, Dr. Shaker is the only interventional cardiologist who operates out of a civilian hospital on Guam.
The issue with these kind of emergency patients is that it's difficult to do these kind of procedures in a facility without a hospital backup. So that's why, ideally these procedures should be done with cardiac surgery backup.
Dr. Shaker says there are other Cath labs on Guam, such as the one at Guam Radiology Consultants, but those operate on an outpatient basis. Dr. Shaker talks about some of the observations he's made in the short time he's been seeing patients here.
So one of the things that was to me is surprising is that, for example, that two patients that we did, one of them is 40 years old, the other is 47, and they have the amount of disease that they have is the kind of disease that you see in 70-80-year-olds on the mainland. So there is both of these patients they don't have the other typical risk factors. They are not diabetics, they don't have long-standing hypertension, they don't smoke.
The addition of another Cath lab at a Guam hospital with an interventional cardiologist and soon, he says, a cardiothoracic surgeon will bring many benefits to the island.
They could have built a hospital without cardiology services or without a cardiac cath lab because it is a big investment. I would like to actually thank the administration and, of course, it was also like a joint effort with the government that helped to have this, to raise the level of care on Guam, because it is very unusual when you compare it to the rest of the mainland U.S.
GRMC's Cath lab is currently open during normal business hours, but Dr. Shaker says soon they will be operating on a 24/7 basis.